Hi, my name's Beth Cooper. This is my first video presentation, and I'm going to talk about legal and ethical issues in health informatics. Here are just a few of the legal, ethical, and social issues that are shaping health informatics profession today. That includes the protection of private patient information, patient safety, risk assessment, reporting design and data display, system implementation, curriculum development, research ethics, liability, and the user involvement and accessibility. Also, ethical dilemmas are shaping what's going on. I am trying to, my sources are going to be seen on the paper, and I also have used Informatics and Nursing by Sewell, the 6th edition that we is part of our class. Okay, so a couple definitions real quick. E-health versus health informatics. Health informatics focuses on developing tools to improve healthcare. eHealth is designed to make it easier to share this information. They work together, and the idea is to provide efficient, top quality patient care. So, researchers that work to develop a process will validate electronic health records to determine whether they conform to necessary standards. In the future, this also will help simplify the overall validation process. Researchers are also working to determine how simulation can be used to strengthen prediction models for infectious disease. Okay, so I want to talk first. Another part I want to talk about is existing health informatic related laws. In 1974, the Privacy Act came into being that requires federal agencies to promote public notice of records and to publish them in the Federal Register. And in comes the word written consent for release of information. This is so important that everyone, when you give your health care, you release the right for them to release information. You need that signature. The other important thing is the confidentiality of alcohol and drug abuse patient records. It also provides protection for people in substance abuse programs that are regulated by the federal government. And this is a high priority to guard their privacy. Then there's the Institutional Review Board, or the IRB. This was established by state and federal government to protect rights in the event of human research. The big thing, the IRB came about because of the Nuremberg trials and what was done to the Holocaust victims. This emerged that our research will be within a moral standard. Joint Commission regulates the eligibility of health organizations to receive Medicare. And then the big act that has changed, I think this has really changed our lives, has been high tech. And that's the Health Information Technology for Economic and Clinical Health Act. In 2009, this came about, and this promotes the health information technology and compliance at institutional levels. And I think we can all agree that technology has really taken off. HIPAA, or the Health Insurance Portability and Accountability Act, further strengthens privacy acts and protections of patients and the sharing of medical information related to employment. Then one other act was the 2012, the Food and Drug Administration Safety and Innovation Act, and this helps FDA speed patient access to digital records and improve safety of drugs, medical devices, and biological products. There still needs to be time when they do research to make sure that the drug is, give it time to make sure they see all the side effects. And I also wanted one more act is the 21st Century Cures Act. And that came into law December 2016. Its purpose is to accelerate development of medical technology and improve patient access to advances in medicine. So those are some laws regulating what's happening in our healthcare industry. Codes of ethics and standards, some organizations that have been made directly because of having informatics is the AHIMA, and that's the American Health Information Management Association. Another one is the American Medical Information Association. I think the biggest difference is one is for medical management is for the doctors, and healthcare kind of encompasses all of the health team. HIMSS is the Health Information Management and Systems Society. This society is a nonprofit organization trying to work with the mission of us working together to protect rights. But back on the American Health AHIMA Code of Ethics, it explains that there's an ethical obligation in health information management to include safeguards of privacy and security, and to privacy of disclosure of health information, and to use the health information system to do no harm. And the 7 purposes for the Code of Ethics in health information is they are the promotion of high standards of health information, identification of core values of health information, and summary of broad ethical principles, establishment of ethical principles used to guide decisions and actions, establishing a framework of professional resolution of conflicts and ethical uncertainties, providing ethical principles that allow the public to hold health information management professionals accountable, and providing opportunities for mentors to guide new let me see if I can get this a little clearer. I'm sorry. New practitioners in ethics education. And it also established standards for ethical coding and standards for clinical documentation improvement. Nancy J. Brandt is a name I've seen a lot when I was referencing looking for legal implications. She is very well published in the website. She writes that the highest priority for health information must be patient safety, and that patient information must be held as securely as possible. So we are very well aware that we need to keep patient safety and doing no harm as priorities in regulating health information ethics and the legalities. What's a code of ethics for nurses? Well, there's key principles, and nurses, like any other healthcare worker, see if I can get this clearer. I'm sorry. Apologize for the unclearness. The 4 main principles that are part of nursing ethics are autonomy, beneficence, justice, and now non-maleficence. I know, and probably you know too, the first one I always can remember is to do no harm. Also to remember autonomy, that a person has a right to their opinions and decisions, and nurses cannot force a patient to do a procedure they don't want to do, or cannot give them a medicine they do not want to take. Beneficence means to act for the patient's best interests and do the right thing. And justice is being fair and distributing your care. Do not have favorites. I got this from nurse.org, these references. These principles are ideally what every nurse should be aware of in their daily nursing practice. Ethical principles are sometimes confusing, and they're taught briefly during undergraduate nursing. They should be a constant in nursing practice to provide the best, safe, and most humane care to all patients. I also saw a reference saying that, and I believe this, that in every shift you are practicing some form of ethics. You are applying those 4 codes I think the biggest thing is showing respect. Other principles of ethics in nursing that I didn't talk about is highlighted as the accountability. And that's a nurse needs to be accountable for her actions, or any professional needs to be accountable for their actions. Fidelity. A nurse must be faithful to their professional promises and provide safe and high quality care in a competent manner. And then veracity is a nurse must be, so I can get this down so you can see it on the slide, that she must be competently truthful to her patients and not hide the whole truth, even if this leads to distress. I think sometimes we're very lucky that there's some information we don't have to share until the doctor tells the patient. And so veracity, I think, comes at certain times, meaning that we need to be respectful of we are not doctors and we cannot give out diagnoses. Another thing I found really interesting was in the journal, it's an online journal of nursing, gave ethical judgment decision making models. And there's 3 different websites, and they each helped give you an idea of how to make decisions to add towards when you're in a situation you really don't know how to handle. And I just saw this picture of Florence and Clara Barton, and just wanted to share we've come a long way. Thank you for watching my video. I hope it comes out okay. Goodbye.